Hello, it's Dr. Jack Wolfson, cardiologist here, and welcome to another episode of the Healthy Heart Show. And now I've got one of my favorite guests, of course, because she works with the doctors Wolfson in our office, and she's a nurse practitioner. Her name is Chelsea Hoese, and she is here, and she's going to tell us all about the wonders of what a nurse practitioner does and how she became a holistic-minded nurse practitioner. And we'll share some stories about her father as well and her father's transformation. And from what I know of her dad, Ian, it is, if Ian can make the transformation, anybody can. If myself, Dr. Jack Wolfson, can make the transformation from eating deep dish pizza and Italian beef sandwiches and hot dogs in Chicago and drinking too much alcohol, along with the toxic cardiology lifestyle, if I can make the change and Ian can make the change, anybody can. So with all of that, welcome, Chelsea. What's happening?
Oh, thank you for having me.
Great to have you on. And, you know, you've been working with us now for, I don't know, about a year or maybe over a year. And we've known each other, obviously, for a few years. And really just patients are loving working with you. You're I don't know if you would call yourself a hormone specialist. I would call you a hormone specialist, male and female hormones. So we get a lot of people, of course, that are coming to you specifically for that. But maybe just kind of dial us in a little bit. Who is Chelsea Hoese and how she became a nurse and nurse practitioner?
Yeah, so I became a nurse back in 2009, and I worked in the ER setting. So, you know, a lot of sick people would come through, and I just started realizing that these people were not getting better. Like the same patients were coming over and over again and getting admitted to the hospital for the same issues. And I noticed there was really no education on diet, lifestyle modifications, exercise even for that matter. And I'd always been kind of drawn to more of the natural approach. So before I was even in nursing school, I used to follow Dr. Mercola and read his articles all the time, and I was just always really into that aspect of it. And then I kind of just got sick and tired of, taking doctor's orders, and I wanted to make a larger impact. So I went back to NP school, and I actually worked in conventional for my first year, and then I was trained on bioidentical hormones by one of the specialists in the area. And I do love hormones, and I would consider myself pretty specialized in that, being trained from her. But then I wanted to step even beyond hormones, do more of total body holistic approach and really dive into, cholesterol issues and blood sugar issues and autoimmune disorders and thyroid problems. So now I kind of take a look at the whole body instead of focusing just on the hormones.
Yeah, it's just, whenever I think about nurses, I get such a warm feeling inside because nurses are such great people. They have no ulterior motive. There's nothing that they're concerned about. They're not, as far as saving the hospital money or getting the patient out as fast as possible. They only want to care for the patient. They only want the best care of the patient. And I learned that right from the get-go when I was in medical school, and then I'm an intern and resident and cardiology fellow, and I've always had such a strong relationship, with the nurses. So to me, whenever someone says, "Oh, I see a nurse practitioner," I always know that they're in good hands because they're not trying to get the person out the door as fast as possible. They're not trying to write the script as quickly as possible. They're not influenced by big pharma dollars. They just want what's best. And you've taken that to another level. You're sitting there and you're in the emergency room, and the doctors are barking out orders, and half of them you disagree with, and the other half you're like, "Wow, there's a better way." And I can feel your frustration because I had the same frustrations as well. And then to come over in the natural side is really, really been miraculous. So when someone comes to you and they have fatigue, they have low energy, maybe they have low libido, they've got low sex drive, where do you go? Where do you go as far as right off the bat as far as lab testing? What are the important lab tests we need to know with these people?
Mhm. So first of all, I would obviously draw their hormones, and I'm not looking, just at estrogen, progesterone, testosterone. I'm also looking at the sex hormone binding globulin and thyroid, because that all plays into it. I'm looking at inflammation markers. I'm looking at their cholesterol. Are they on a statin, which is going to block all of the sex hormones? It's what's literally needed at the top of the pathway for your body to make its hormones, and that's getting blocked in a lot of patients. I'm looking at micronutrient tests. There's, certain vitamins and nutrients that are needed for the body to produce testosterone. I'm looking at, cortisol markers. Sometimes patients are in adrenal fatigue, especially with men. When cortisol goes up, the testosterone goes down. And so that's kind of where I've moved from doing where bioidentical hormones, there's a lot of providers out there that'll just say, okay, low testosterone, let's put you on bioidentical testosterone, which sometimes that is a good option, but first I want to try and figure out why. Why does this male in his late 30s, early 40s have low testosterone? That's just not normal. So yeah, kind of taking a look at the bigger picture and trying to always fix the underlying cause.
I definitely like that about you, and obviously the way I practice as well is that, yeah, there are so many of these doc in the box places, and nurse practitioners even, that once again, yeah, your testosterone's low, here it is. You went through menopause and now you're having all these different symptoms. Well, here's your hormones, whether they're synthetic or they're bioidenticals. And they're not going after the causation. And I really like that about you as far as what your approach is. And it should be every practitioner's approach, MD, DO, nurse practitioner, no matter what specialty you're in, to always go after cause. And we're looking, so if the hormones are off balance, why? Now, if they're extremely out of whack, like say, a male with a testosterone level of under 100, well, we probably want to start that person on some form of therapy as soon as possible, because they're really at a danger zone, whether it's physical, but certainly mental. And then we ask questions as we go along, as we try and maybe minimize the dosing. But for those people that are kind of borderline, that's where we go after the cause. And we look at things like the sleep, and we look at the sunshine exposure, and we look at the diet, and we look at additional pharmaceuticals, and we look at all these other factors in their life. So I certainly applaud that for you and what you're doing. Tell me as far as how do people feel though? I mean, so let's say they're feeling down and out. We're addressing all the cause. We're putting them on the right lifestyle and the right nutrition, and we put them on hormones. What are the kind of stories you're getting from these men and women?
Mm-hmm. I mean, they're definitely reporting that they'll feel a lot better. For men, for example, the classic one is low libido, but oftentimes they'll be misdiagnosed with depression and be put on, an SSRI, and then they feel worse. So oftentimes, they're feeling a lot better right away mentally, emotionally, motivation-wise, their mood, their energy, their libido, just their overall outlook on life. They feel a lot better. For women, when they're going through menopause, sometimes it just hits them really hard right away. So they'll feel like they don't even feel like themselves. They're like, I feel legitimately crazy. Like my husband says, I'm not myself. I'm just super snappy, irritable. I'm depressed. I don't enjoy anything. So they'll notice a benefit usually within a couple of weeks. It's like a complete 180. I feel so much better. So yeah, that would be the normal outcome.
It's pretty rewarding, for us obviously to get into, this space, and when people are, so down and out, and like you said, they were labeled with depression and no one ever checked the hormones. They were put on pharmaceuticals without any improvement. And once again, somebody can also be told that their hormones are in the normal range, yet they may not be normal for the individual person. And because who's to say what's one male's testosterone level could be 500 or 700, but we got to find the perfect level for each person. And let me segue that into the, you mentioned before the sex hormone-binding globulin. What is that, and how is that a factor?
Mm-hmm. So SHBG, that will bind with your testosterone. So it binds with a lot of the sex hormones, but for men in particular, they may have a normal total testosterone level, and most conventional providers are only checking a total testosterone. They're not looking at your free testosterone. So they'll have plenty available, but then when we look at their free testosterone, that'll be really low. And then if the sex hormone binding globulin is high as well, then that means that that's just binding with all of the testosterone and making it unavailable. So by, lowering sex hormone binding globulin, which can be done with zinc, that's the other one. There's a few different minerals.
I know that one of my favorite ways too is they talk about with intermittent fasting, and intermittent fasting can free up that SHBG. And I think overall, and I know you find this as well, that when you follow the healthy lifestyle, and maybe we do some strategies to kind of clean out the liver a little bit, that a lot of that stuff goes down. But as you said, the doctors aren't checking the SHBG. What about SHBG as far as binding up testosterone in women? How much is that a factor?
Yeah, I mean, it's as much of a factor in women as it is in men, for sure. And sometimes the SHBG will go up in women from being on a thyroid medication or from being on oral estrogen. So, there's a fine balance between them all. And sometimes we have to lower, the estrogen medication a little bit, or their cream, their bioidentical estrogen cream. We'll have to lower that a little bit sometimes in order to free up more of the testosterone. So there's definitely a fine balance between them all. And, a lot of people are being put just on, one type of estrogen, but they all need to be balanced together. The testosterone, the DHEA, the estrogen, they're supposed to be a nice balance of each other along with the thyroid.
What about pregnenolone? Is that a factor? Do you have any experience working with pregnenolone?
Yeah, definitely. So, pregnenolone is literally the first thing after cholesterol. So cholesterol is at the top. That's needed to turn into pregnenolone, and then pregnenolone will literally convert all the way down into all the hormones. So pregnenolone is really good to use to kind of let the body do what it needs to. It'll convert it into a little bit of estrogen, a little bit of testosterone, a little bit of DHEA. And unlike, estrogen and testosterone, where there's a very fine line between too little and too much, you don't have those issues with the pregnenolone.
Fantastic. So somebody thinks maybe their hormones are an issue. How do they find a good hormone doctor? How do they avoid that doc in the box who puts up a sign that says, hey, you're a man with low libido, then come on in and get testosterone injections, or you're a woman who's got depression, anxiety, stress, let's cure it all, let's just put you immediately on bioidenticals. How do we find the right practitioner to work with?
Mm-hmm. Well, I mean, definitely someone who's been trained in bioidentical hormones is important. You definitely don't want to be put on the synthetic hormones. Those cause a whole bunch of problems, and that's actually why hormones have a bad name, is from the synthetic hormones. They had to stop a study of about 5,000 women. They had to stop it because it was causing so much cardiovascular events and cancer. So then bioidentical hormones kind of got lumped in with them as well. But bioidentical hormones, the body recognizes them the same as it would their own hormones. And we know our own hormones don't cause all those issues. Otherwise, women in their 20s and men in their 20s would be running around having all these events. So someone who specializes in bioidentical, BHRT, definitely naturopaths, functional medicine providers, and then just kind of advocating for yourself and saying, what kind of tests are you guys looking at? Are you just looking at testosterone and estrogen? Are you going to look at my nutrient status? Are you going to look at my gut health? Are you going to look at my cortisol? I kind of almost like you're interviewing them to find out what's their process for treating you.
Yeah, fantastic. And I know obviously when people come out to see you, you run through the whole gamut. You talk about nutrition, you talk about sunshine, you talk about sleep. We work hard to get people off of pharmaceuticals, like you said, statin drugs or other pharmaceuticals that are inhibiting the natural function of the body, right? All these drugs, they're all inhibitors. Like statins are an inhibitor of the HMG-CoA reductase enzyme. ACE inhibitors, angiotensin receptor blockers, H2 blockers, proton pump inhibitors. It's all inhibiting or blocking some critical necessary function in the body. So we work to get people off those pharmaceuticals. And then, like you said, using the most advanced testing in the world to look at their overall nutritional status, looking at leaky gut, looking at markers of inflammation, addressing their teeth, recommending that people get functional body work, people are under the care of a doctor of chiropractic, all these things that we do, and we get tremendous success. And then if at the end of the day, if their hormones are not perfect, I know we both agree that is a place for hormones. What about some of these doctors though that think like, no, every woman who is postmenopausal needs to be on hormones? What would you say to one of those people?
Mm-hmm. I mean, I would say that it's really a case-by-case process. I mean, if there is benefit to our hormones, they are very protective to us, but, you know, one woman may have, you know, hormone levels of 0 and feel fine, whereas another woman won't. And, you know, there's some debate that is out there of, well, we're living longer and longer, so we need to, you know, replace those hormones in order to, you know, protect us from chronic diseases. But I mean, I wouldn't say that's necessarily true, because the body has a really good ability to adapt. And again, a lot of the stuff with hormones goes back to how are you feeling, because, you know, how are you feeling really tells the whole picture. It lets you know if your body is functioning properly or not.
Yeah, I think that whole point is that, you know, people often think that our ancestors all died when they were 50. And the answer is actually that's very far from the truth. Our prehistoric ancestors lived a very long life. Now, once you started moving into modern societies and modern food and modern civilization, there was a lot of sickness and led to people to die at an earlier age. But even then, a lot of people lived into an older age. So if you're a 50-year-old woman and you're going through menopause, and now you've got an extra, you know, 30, 40 years of your life, and women, once again, have done this without the use of hormones. To me, that stands to reason that, you know, all women don't need, like, you know, don't need hormones. My mother is 74 years old and she's not on hormone therapy and feels fantastic. I mean, why, you know, why is it always better living with hormone therapy?
Yeah. Why is it what?
Why, and why, you know, once again, it's just, why do so many people think that it's just better living with hormone therapy?
Yeah, I'm not really sure. I mean, I just think that, you know, they'll hear, oh, well, so-and-so went on testosterone and he feels great. And I've had patients come to me and they say, oh, well, you know, my friend told me it was awesome. I got to get on it. And I said, okay, well, what kind of symptoms were you having? Oh, none. I felt fine. So again, why is somebody putting you on something when you don't even have a clinical indication for it?
Especially some of these younger guys too, where their testosterone was tested. And I guess anybody would say what normal is above 350, and that's a total testosterone, and there should be a good range of free testosterone as well. Yet we've both seen men who were put on testosterone had no symptoms whatsoever, yet their levels were a little bit low for conventional testing, and then now they're stuck on testosterone. How do we get these men off of testosterone if they never really needed it in the first place?
I mean, typically I just tell them to stop taking it, and I'll supplement them with DHEA and some DIM, because the DHEA is another male hormone, but it's also an adrenal hormone, so it helps to balance the adrenals and keep your stress hormone cortisol down. So I'll put them on that, and then I'll put them on another supplement that helps to healthy conversions into like the good estrogens instead of into the bad ones, or to prevent from dihydrotestosterone, which is one of the bad testosterones. So yeah, I'll typically just have them just stop. I mean, right away. I've never really had to taper somebody off, and that's something that men are concerned about. If it was a young male, then I would be more concerned, because again, we're trying to figure out why they're not making it, as opposed to an older man who's already used to having a little bit lower levels and feels fine.
Okay, so you mentioned DIM. Tell me what DIM is and why would somebody want to use it?
Okay. Gosh, what does this stand for? Dimethanol?
I'll tell you what, we'll put that into the show notes, and that's why there's an abbreviation, right? Because nobody can pronounce it. But why would someone be taking DIM, and what's its function?
So I usually put anybody who I have on hormones, or even pregnenolone or DHEA, I have them on that. Like I said, in order to prevent the conversion into the bad testosterone and the bad estrogen, which are cancer causing. Basically it comes from cruciferous vegetables, I believe is where it comes from, and it just helps to cause healthy conversion of hormones. So anyone on hormones needs to be on that. Sometimes men will come see me, and their testosterone is actually normal. They'll have all the symptoms of low testosterone, but we'll do their levels, they're normal, but their estrogen is really high, especially in men who are a little bit overweight. They have insulin resistance. It causes higher conversion into estrogen. So their estrogen is kind of blocking the testosterone from working, because those are supposed to be a fine balance. Men should have a small amount of estrogen, just like women should have a small amount of testosterone, but definitely not more than, the hormone that's driving them.
And I think that's where, Chelsea, where a lot of the danger comes in, where cardiologists like myself have seen men and women get into trouble with hormone therapy, is that they're put on hormones, but there's no follow-up done, or the appropriate testing is not there. So if you're a male on testosterone, you better know what your estrogen and estradiol levels are, because if they're high, you're in trouble. You're in trouble, and I think that obviously markedly accelerates cardiovascular risk. Oftentimes men are put on an anastrozole, which is a pharmaceutical that would block that conversion from testosterone into estradiol. But correct me if I'm wrong, that's something that DIM can do, and that's what we're using. We're using something in the natural way in the form of DIM that comes from, as you said, cruciferous vegetables, as opposed to a pharmaceutical with a whole host of other side effects.
Definitely. I would say, most men respond well to the DIM. Some men, they don't. So then it's, okay, well, are we using too much testosterone? And I'll kind of look at that, because I do always try to avoid pharmaceuticals whenever I can. But I can't tell you how many times that my family practice, the conventional medicine one, I would see men all the time who I kind of took over their hormone therapy, and they're having their testosterone level checked, once a year, and just their testosterone, not their estrogen. And I, do an estrogen level on them, and it comes back like 90, 100. I mean, for men, it should be more like in the 20 to 30 range. So, and you're right, it's definitely puts you at high risk of cardiovascular events, blood clots even.
I know this about Chelsea, ladies and gentlemen, and that, Chelsea likes to work hard and she likes to party hard. There's no doubt about that. And her husband, they're still relative newlyweds compared to Heather and I have been married for over 12 years, but you guys are relatively newlyweds and you guys like to travel and have fun. But, but like I said, you like to work hard too. And for every hour you spend with a patient, I know you are doing another hour on the back end, researching stuff about that patient and making sure that everything's dialed in. And I can just tell you that that other practitioners, of course, are not doing that. And I know I didn't do that. I saw someone who was a 10-minute office visit, and that was the only 10 minutes I ever thought about that person. And that's one thing I commend about you, Chelsea, is that you're really you're talking the talk, you're walking the walk as well. And, once again, just providing tremendous service to your patients and clients. And I really, 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 really respect that about you. So thank you.
Yeah, thank you. I just love it. I'm a total nerd, and I could just go researching, functional medicine things for hours. So yeah, before, when I have that first lab review with my patient, I'm always getting on the night before and looking at all of their labs, trying to put together the bigger picture. And I'm putting, all kinds of educational links on their notes so that they can further go educate themselves, because even though we're with them for an hour, there's always more education that they can have. So yeah, I love doing that, and I like to give them lots of notes and lots of resources, because ultimately they need to be advocating for themselves as well. And a lot of the patients that we see already have done a lot of their research on things, so that's nice. They come in willing.
Yeah, no, most certainly. And I don't think you're a nerd. I saw pictures from your 30th birthday, so you're not nerdy. I've become nerdy over my years of being married and a father of 3. Health coaches, because you talk about when we see a person, whether I see him or you see him, at the end of the day, you and I are both, very busy. And we want to, continue to educate people and to continue them on the process, as opposed to we just kind of spit out all this information and go over the lab test results, and they're like, okay, what do I do now? I get some of it. Tell me, how do the health coaches really help to assist you and your patients?
Well, our health coaches are amazing. I mean, I'm constantly learning from them. They're constantly learning from me. And, they actually are there to kind of hold the patient's hand for the first 3 months or so after they sign up with us, and they're there to answer. They have unlimited emails, they have phone appointments with them, and say they'll just have a simple question about a supplement. Am I supposed to take this in the morning, or am I supposed to take it at night? That's where they come in, and they're able to help with things like that. And if it's a question they can't answer, then they'll definitely email me or call me. But, they're just a great support for patients. We go over so much information in that 1 hour, and then they walk out kind of confused or don't know where to start. So yeah, they're there with a great education, and they have tons of knowledge, and they're there to kind of hold their hand through this transition to health.
Yeah, I think it's really something very unique. And I think, we're lucky because we've got such amazing health coaches, but our health coaches are available to anybody just on their own. Anybody can sign up for a health coaching package with our health coaches, but find a good health coach because they're really your advocate. And oftentimes I tell people, if they're looking for a holistic practitioner, actually find a health coach first, and then the two of you together can find a doctor in your area that really suits your needs. But once again, they're like your greatest advocate, and they can help synthesize, the information the doctor gives and keep the doctor on their toes, to make sure that everything is dialed in. So, I promised everybody we would talk about your dad. Tell us a little bit, maybe, and without spilling the beans too much, and your dad's confidentiality. But I'll let you say it because you're the daughter. But
Yeah. Well,
I know Ian is very proud of you. I know he's very proud of himself and his accomplishments. I know you're proud of him. I know I'm proud of him. So everybody's happy for each other. Tell us how Dad's doing.
Yeah, so, he's actually given me permission, and he wants to do a testimony. But my dad, has always been overweight, always ate pretty unhealthy, growing up. He smoked cigarettes for a while. He drank for a while. And kind of what pushed him over the edge to change is that, my stepmom, Helen, she unfortunately died from brain cancer. And, in that process of her with that cancer, she was going to, a major cancer hospital, and they were just putting her on medication after medication after medication. And she was on 15 different prescriptions before she died, and she was never on any. And they're just trying to figure out, well, which one is causing this symptom? And, I think it all just made her a lot worse, to be honest. And he just said, I don't want to ever be like that. And he'd had a 4-way bypass surgery a couple of years prior. So that's when, I was referred to you, and I brought him in here, and he walked out of those doors just 100%, never drank an energy drink again, doesn't drink coffee anymore. He eats only paleo. He got rid of all the gluten, and he'd lost about 70 pounds, and his blood work just looks perfect. I mean, he says he feels better at 60 than he did at 50. He's working out at Orange Theory Fitness 4 times a week. And, actually recently his blood pressure started creeping up a little bit again. And I said, he's a high stress person in his job. I said, are you going to the chiropractor? And he said, no. I was like, you need to get into the chiropractor. Within 3 weeks of going to the chiropractor 3 times a week, followed by a bunch of stretching that they would do with him, his blood pressure dropped back down 20 points, and it was just perfect. And that's a great example. People don't realize that chiropractors help with these sorts of things. They think they're just in there for musculoskeletal problems, but it's really the entire body that they're able to help.
Maybe what we could do also with your dad's permission is in the show notes and the blog post, maybe and obviously it should live in a lot of places because it's very motivational to show a before and an after picture of your dad because it's really fantastic. He's such a good dude. Chelsea, thanks so much for being on this episode of the Healthy Heart Show. I think you represent the holistic nurse practitioners so well. So thank you. And thank you for being part of our lives and part of our practice. And for those of you that are interested, if you want to come out and see the best holistic cardiologist on the planet, it's myself, and you want to see one of the best holistic nurse practitioners, I don't know how it gets any better than Chelsea Hoese. So thank you, Chelsea.
Thank you so much. Thanks for having me.
You got it. This has been another episode of the Healthy Heart Show with Dr. Jack Wolfson. We'll see you next time.